leg was about 3 times bigger than my left leg.
They just said that he would grow out of it. The leg just kept getting bigger and bigger.
We realized just how serious this was.
I knew my daughter was in trouble.
When I did force myself to eat an entire meal, I would projectile vomit. Nobody knew what was happening to my body.
Next, two medical mysteries that defied the experts. Adrian Martinez loves playing football more than anything. But that all changes when his leg begins growing in a way he could never have imagined.
But nobody really knew what was wrong with him.
I couldn't stand being alive anymore.
Then, when 19-year-old Samantha Mina hits 87 pounds, she begins to wonder how much longer she has to live.
My throat was closing, my chest was tightening. I was hitting rock bottom.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery.
In the summer of 2005, Maricela Cruz was raising 4 children in the West Texas town of Socorro. With no man in the family, she felt especially close to her oldest boy, Adrian.
At that time, I wasn't working. I had a pretty hard life then.
But despite his family's hardships, for 12-year-old Adrian Martinez, it's a carefree time.
I had a lot of friends. They lived in my neighborhood. My favorite things to do was to ride my bike around.
Always active and energetic, Adrian appears to be in perfect health. Nothing seems out of the ordinary, except for his large birthmark.
It was the whole leg from hip to ankle. It didn't really bother him all that much.
The birthmark, it was a little pink. I didn't even notice my leg. Everything was good.
But one day that September, as Adrian is getting ready for school, he suddenly experiences a very strange sensation. His right leg is extremely hot.
I could feel the heat waves coming out of my leg.
The heat was pretty intense. I think I could compare it to an iron. And that's when I took him to the pediatrician. They just said that he would grow out of it.
But over the next 4 months, the bizarre feeling only intensifies.
I noticed my leg getting hot all the time. I just thought it was like a freakish thing that was happening to me.
And it's not long before Adrian notices something even more disturbing.
I was playing football with my friends, and I felt a heaviness in my leg, and it was getting real hard to walk. I noticed that my right leg was a little bit bigger. I was just didn't know what to blame it on.
Hoping for the best, Adrian tries to ignore the change in his leg. But over the next month, it seems to grow even larger.
I noticed that his leg was getting wider and bigger as he was going through puberty. I really didn't know why it was getting so big.
It was about 20% bigger, and it was swollen up all the time. I couldn't ride my bike anymore because my leg was rubbing against the frame of the bike.
His leg was actually growing so fast. I just knew something was terribly wrong with my son.
Alarmed, Maricela brings Adrian into the local clinic.
His pediatrician really didn't have any knowledge of this problem. He just recommended that I just leave it alone. I was not satisfied with that response, so I decided to ask a couple other doctors.
She takes Adrian from appointment to appointment, but no one can explain why his leg keeps growing.
The doctors would just run tests, and they never really told me what they were looking for. And then they would say there was nothing wrong with him, that they couldn't find anything.
At this point, I was seeing the doctor at least once a month. My right leg was about 35–40% bigger. I was getting really frustrated and mad at the doctors because I thought that they should know everything and that they should know what was happening to me.
But nobody really knew what was wrong with him. I just wanted some answers. Wouldn't anyone help my son? The leg just kept getting bigger and bigger.
In 8th grade, I was getting depressed about the size of my leg. I realized that people were looking at me. They were laughing.
It was something that, nobody has ever seen. He could not hide this problem at all. Even if he wore baggy pants, it was very noticeable.
It was getting real hard to walk. And after a while, my ankle started hurting. I feel like a sharp pain, like someone was hitting me with a hammer.
Frightened by his painful new symptoms, Maricela takes him to the hospital.
They did all kinds of studies to see if they can find something wrong with his leg.
They're doing x-rays to see what was around inside my leg. They were checking the radius around my leg. They're doing MRIs and CAT scans, and I was worried that I had cancer or disease that could kill me in 6 months.
My biggest fears about the doctors running these tests were for them to tell me he might pass away.
Over the next 3 weeks, Adrian and his mother wait anxiously. And finally, the results are in.
The doctors told me that I had elephantiasis.
Elephantiasis is an extremely rare disorder of the lymphatic system, which causes tissue in the lower half of the body to dramatically thicken and swell. The condition is not well understood, and there is no known effective treatment.
I was shocked. They told me that there was nothing that could be done, that we had to wait till he got older and see what would develop from there.
I was just wishing for it to just stop growing. It made me feel kind of sad that would never happen.
Horrified, Adrian returns home and tries to manage his condition the best he can. But his leg continues growing. By his sophomore year, it's 2.5 feet in diameter and weighs 100 pounds.
I could barely even walk from class to class.
Adrian would have to leave like 10 minutes earlier to get from one side of the school to the next.
When they let me out of class early, I wasn't walking fast enough, so when I was going up the stairs, I got caught between everybody that was trying to go up and down the stairs.
Somehow, Adrian gets through the school year, but the leg persistently balloons up.
When I was a junior, my leg was about 3 times bigger than my left leg. It was about 56 inches around. Yeah, I was scared.
As a young girl growing up in Reston, Virginia, Samantha Mina enjoyed an especially close relationship with her mother, Samia.
Samantha is the best thing that ever happened in my life.
My mom was always super supportive of me. Anything I wanted to do, she definitely believed in me, said go for it.
Their relationship grew even stronger when they found themselves on their own in the fall of 2000.
I was 12 years old when my parents divorced.
It was a very difficult time. She's the one who used to take care of me, encourage me. Samantha was an adult before her time.
Definitely after my parents divorced, my mom and I became best friends and started telling each other everything.
As an Egyptian immigrant, Samia believed firmly in the American dream and always encouraged Samantha to do her best.
Samantha was always an A-plus student. A is not good enough.
I do consider myself an overachiever. I've always been very driven, definitely had to be the absolute best at everything I attempted.
In school, Samantha was a dynamo. She consistently brought home top grades and was active in sports, despite her small build.
Samantha was always tiny since she was a little girl.
I definitely have a small frame, bird bones, my mom calls it. I was thin, but I was also healthy. I would do everything all my friends did. I was involved in cheerleading. I got into archery when I was in high school. I really enjoyed running. I was one of those students who tried to do everything.
And when Samantha graduates from high school in the spring of 2006, she can't wait to start her freshman year at the University of Virginia in Charlottesville.
Samantha was very excited to go to college. She wanted to be a professor.
My life was definitely going all according to plan. I took my studies very seriously. I would study every night for hours.
Samantha's very driven, and if it means staying up till 2 a.m. to finish an assignment, she'll do that.
As the end of the spring term approaches, Samantha and Alex celebrate at a local restaurant. She has no idea how radically her life is about to change.
We went to a fancy gourmet pizza place, and I had a big slice of pizza, and I remember about 3 bites in, I felt a stabbing in the upper left quadrant of my belly.
And I thought maybe it was gas. She said, no, it's different.
It was very, very intense.
Within a few hours, the agonizing pain subsides, and Samantha thinks little of it. But over the next 4 days, the debilitating cramps return again and again.
Every time I would eat or drink anything, I would get this stabbing pain. I wanted to scream. The only thing that could make this pain diminish or go away was to not eat. I began to think that something is seriously wrong. So I went to the doctor. I described my symptoms, and I told him I feel like my stomach is being twisted every time I eat, and he said, well, most likely you have irritable bowel syndrome.
Irritable bowel syndrome is a common disorder of the large intestine, characterized by cramping, diarrhea, and abdominal pain. Its cause is unknown.
The doctor said that the only way to handle it is to just simply try to avoid the foods that set you off. And he said all you have to do is figure out which foods cause so much pain and just avoid those foods. And, I thought, that's a possibility. That might be the case. That's when I decided that I would not even attempt fatty foods, junk food, sugar.
I thought if she just ate the right things, then she would be fine and she wouldn't have any more problems.
So I put myself on a very bland diet. I would eat plain bread, crackers, boiled vegetables, boiled chicken. But I found that even the bland foods would cause pain. This sharp, stabbing pain at my upper left belly. It was like a knife, a hot knife, stabbing me over and over in the same spot. It was just so painful.
Then, to make matters worse, just a week after visiting the doctor, a frightening new symptom begins to emerge.
We went on a shopping trip and she ate some of the food that we had at the mall. She went to the restroom and when she came back out, she told me that she had thrown up.
I thought that it could be food poisoning or a stomach bug, and it would pass.
But over the next 5 days, Samantha doesn't feel any better and soon finds that eating more than 3 bites of anything makes her throw up.
I learned to decrease my portions, and so, if I would eat just a handful, I would feel a tiny bit in my throat come
Over
back
the
up.
past 3.5 years,
when I did force myself to eat an
15-year-old
entire
Adrian
meal,
Martinez
I would
has watched in
projectile
horror
vomit.
as his right leg has grown in
And
a way
along
no
with
one
the
could have
vomit,
ever imagined. The stomach pains seem
By
to
his
be
junior
reaching
year,
a whole new
it's a
level of
grotesque
intensity.
56
56
I think
inches
it was
around
torturing her.
and
She got
weighs
to the
nearly
point where she didn't wanna
150
eat.
pounds.
I became afraid of food
Just
because
when he thinks it
food
can't get any
always
worse,
inevitably
a
equaled
shocking new
pain.
symptom begins to emerge.
I grew to
I
hate
started
meal
getting
times.
little
I'd
pimples
have this empty
on the
feeling
right
inside
side
of me,
of
this
my leg.
lack of energy, being
They
drained,
were
the
full
need to
of white
eat.
pus.
But I knew if I ate,
When
I would
the
be in
pimples
pain.
would pop, it
By
had
the
a
end
very
of the
foul smell
semester,
to it.
Samantha, who normally weighs 100
I
pounds,
took
is
Adrian to the
painfully thin.
dermatologist. He didn't say
I was
what
around
wrong with
87
the skin.
pounds.
He mentioned that this was the
This
biggest
was
leg he
very
has ever
alarming.
seen.
So
he
I
actually
called my
didn't
mom.
know why the leg
It was
is
very
bigger than the other.
worrying,
The dermatologist
very
told Adrian
disturbing.
to do his
So I
best
stopped
to
at
keep
work.
his
I
leg
told them,
clean,
I'm not coming today. I'm going to
just
get
by
my
showering.
daughter.
2 hours later,
At a dead end,
Samia walks into
Adrian
her daughter's
watches
room
the
and
disturbing
is shocked
pimples
by what
multiply,
she sees, while his days
When
in school
Samantha
turn
changed,
into
I
a
saw
nightmare.
her arms and her
felt
legs. I can
really
see
scared all
the
the time.
detail of the bones.
If they would pop
She
in the
had
middle of
black
class,
under her eyes,
and
her
whenever I
face
smelled
got
it, I
very
just thought that
pointy,
everybody
and
else
it
would
scared
smell and
me.
they'll just
I
stare
could
at me.
not believe myself
So I
what I
couldn't
have
stand
seen and what was going on with her.
Being alive.
I knew my daughter was in trouble and there was no time to waste.
Then, just when Adrian feels like he's hit rock bottom, a teacher at his school takes him under his wing.
The first time I met Adrian, I made it a point to find out more about him and talk to him about what he was going through. He was a bit frustrated in regards that the doctors really didn't know what to do, what it was. I realized that not only was Adrian really, really special, but he really needed a lot of help. We live in a community where there's not a lot of resources. I wanted to try to get him to a specialist, and maybe there's some type of medication, maybe some type of therapy that will help him have a normal leg. Adrian and I started searching the internet.
It felt really good that a person that was first a stranger would be like one of my best friends.
As we started to research this elephantiasis, we realized that some of the symptoms didn't quite match up with everything that he was going through.
Sure, he's onto something. Luis redoubles his efforts, and 2 weeks into his search, he comes across a disease that seems to match Adrian's symptoms to a T.
I talked to some of the experts about Adrian's condition, and they were able to point us in the right direction to get the best help available for Adrian.
2 weeks later, Dr. Robert Rosen, a New York endovascular surgeon, agrees to look at Adrian's file.
What stood out to me when I reviewed this patient's history was the degree of enlargement of this limb. In the years that I've been practicing, I've seen a handful of patients that had this degree of involvement of one extremity. After reviewing Adrian's medical records, it was clear to me that Adrian was suffering from Klippel-Trenaunay syndrome, or KTS.
Klippel-Trenaunay syndrome, or KTS, is a rare congenital abnormality that generally involves one arm or leg. In a healthy individual, a complex system of arteries, veins, and lymph channels develop in a fetus to carry blood and lymph fluid throughout the body. But in patients like Adrian, for some unknown reason, these vessels fail to form properly. As a result, 2 things happen. First, deoxygenated blood or lymph fluid collect in the affected limb, causing swelling. Then, tissue overgrowth and skin abnormalities may develop, resulting in deformity.
KTS, which stands for Klippel-Trenaunay syndrome, is a malformation of the blood vessels and abnormality of the lymphatic system. And it usually involves one limb, usually a leg, during the course of blood and lymphatic vessel development, which is a very complex process in the embryo and the fetus. All of these primitive vascular spaces that are there at the beginning, which normally refine themselves into arteries and capillaries and veins, somehow get disordered. They're called cavernous venous malformations. They grow with the individual. And there are some situations where hormonal changes can cause the malformation to become much more active, typically at puberty. The tissue overgrowth is not completely understood. Part of it is either blood or tissue fluid accumulating in the limb, just making it larger. And then there also tends to be an actual overgrowth of the tissues in the extremity.
I realized just how serious this was. As we researched more and found out more about it, we came to the painful realization it could be a great danger.
I was really scared I would probably die.
19-year-old Samantha Mina has been unable to eat more than a handful of food without experiencing severe pain and vomiting. Her doctor is confident that irritable bowel syndrome is triggering the symptoms, which can be managed by simply changing her diet. But when Samantha's weight plummets to 87 pounds, she's sure something else is going on and makes an emergency appointment with a specialist.
I saw a gastroenterologist. She gave me an exam, pressed on my stomach in a lot of places. The doctor weighed me and told me that I had what she described as the typical profile of an anorexic, which is young, female, perfectionist. Anorexia nervosa is an eating disorder in which someone deliberately does not eat for the purpose of getting thinner. She told me that I wanted to starve myself. I was just shocked that she would jump to that conclusion immediately when my stomach pains and vomiting were so real, so terrible. I just couldn't believe it. It just made me so mad.
I knew that it was not anorexia. There was something physically wrong with her.
Desperate for an explanation, Samantha sets up appointments with every kind of specialist she can think of.
I went to see a cardiologist. I went to see a rheumatologist. I went to see a hematologist. I must have seen over a dozen doctors and taken as many tests. I was scanned, prodded, poked, x-rayed, just one thing after the other, and they hadn't found anything. Besides telling me that I was underweight, nobody had any answers for me at all, and that was very frightening.
By October, Samantha weighs a shocking 72 pounds, and her health is rapidly deteriorating.
Sometimes I would just get dizzy and tired. Walking back to my room, I would take rests on the curb, put my backpack down, sit down, put my head between my legs sometimes because I'd just be so tired from walking. My illness made me feel just isolated from the world. It was just me and my pain, and nobody would believe that it was there. One November afternoon after class, I wanted to catch the bus to shorten my walk back to my dorm. And the bus started to leave without me, and instinctively I started to jog after it, hoping the driver would see me so she would pull over. And then I felt like my throat was closing, my chest was tightening. I felt like I couldn't breathe. Next thing I knew, somebody had called for an ambulance. Everything happened so fast, I didn't know what to feel. I was just basically trying not to panic. When the ambulance came, they put me on a stretcher and lifted me into the ambulance. I was taken to the hospital, to the ER, and there they checked my heart rate. I was given an EKG. The doctor said that my heart was weakened by my weight loss. He said the heart is a muscle, and just like you've lost most of the other muscle in your body, you've probably lost some of your heart muscle because you are so underweight. So now your heart has to work very hard, pumping really fast in order to provide enough blood and oxygen. He said that according to the World Health Organization, I was below the starvation point. And that was a very frightening thought. I was hitting rock bottom.
I was very scared for Samantha. It was very scary. I was scared she was gonna die.
It was really frustrating and frightening because nobody knew what was happening to my body. I was reaching the end of my rope, so I was thinking I have to take matters into my own hands.
Samantha throws herself into researching her symptoms, and just 3 days later, she's onto something.
I noticed with all the tests that were being done that they were all focusing on my stomach or my large intestines. So I started thinking, what about everything in between? So I did some research and I read about an upper GI series and how that got good images of the entire stomach, small intestines, and large intestines.
Convinced this may be the key to understanding her condition, Samantha requests an upper gastrointestinal series with radiologist Dr. Ziad Haddad.
I first came into contact with Samantha on January 18th, 2008. Her body was telling her that something was wrong, and she was determined to get to the bottom of it. I was quite surprised with the severity of her symptoms.
That afternoon, Samantha undergoes the test.
So an upper GI series is a study performed by a radiologist where we use continuous x-rays called fluoroscopy. It's a way of looking at the upper digestive tract.
The patient drinks barium, a contrast solution that allows the radiologist to watch in real time as the mixture travels through the digestive tract.
During the test, he said, "I see a problem. The solution is not flowing through your intestines." He said, "This is extremely serious." I was very frightened, but I was determined to find out what was wrong.
16-year-old Adrian Martinez has just learned that he has KTS, a rare disorder which has caused his leg to grow horrifyingly large. But to Adrian's shock, his birthmark, which no one thought important, was in fact the first sign of the disease.
Classically, KTS involves kind of a reddish-purple birthmark. The reason these birthmarks are sometimes warm to the touch is that the blood is obviously warm. Most likely, as he grew, the blood flow became higher to the surface of the skin, and the closer the blood is flowing to the surface, the warmer it will feel to the touch.
Even more surprising, Dr. Rosen suspects that Adrian's right leg was always bigger, but it wasn't noticeable until puberty sped everything up.
In the average case of KT syndrome, the abnormal tissues in the leg will grow along with the rest of the body. These are fairly subtle at birth and may become more apparent as the child grows. And generally, when growth stops in late adolescence, early adulthood, the malformation will stop growing.
And while Adrian struggled to live with the incredible transformation, the next symptom to surface, the pimples on his leg, added to his distress.
Fluid pressure in the tissues is so great that it just infiltrates out to the skin surface, forms these little blister-like areas. Undoubtedly, the tissue fluid in his case was probably infected, and probably why he had recurrent inflammation. As in any infection, an odor can develop related to that. The most serious aspect of these soft tissue infections is that they can spread very rapidly, and they can cause instability of the blood pressure, and can be life-threatening.
I'm really glad that, they were able to tell me in time.
But her relief turns to fear when she learns that nothing can be done to prevent a life-threatening infection.
The lymphatic malformation, when it's abnormal, there's no direct way to correct it. It's such a tiny network of small, almost microscopic vessels that you can't reconstruct them or rebuild them in any way. This patient's history was really the extreme end of the spectrum of KT syndrome. It's extremely rare to have this degree of limb enlargement.
The doctor said that the last thing I could do to have a chance of living a longer life was to get my leg amputated. I felt like the wind just knocked out of me.
The risks were very high on the surgery. They told me that he has a 50% chance of dying on the operating table because he had so many veins, and that in the process of the operation that he might bleed to death.
I was really scared that after everything that I went through, that I would just die all of a sudden on the table. My mom, she told me that ultimately it was my choice. I decided to do the operation.
I think that he has a real strong character because it's so hard to make this kind of decision, especially at a young age.
A lot of conservative measures had been tried, and it was just unmanageable. Living with this on a day-to-day basis can be less traumatic to live without the limb than to have a limb that's endlessly causing problems.
In October 2009, Adrian is wheeled into surgery at a local hospital.
The last thing I said to my mom before they took me into surgery was I told her not to worry about anything. And I told her that I love her.
I told them that I loved them and that everything would be okay. A whole lot of things were going through my mind. Especially, you know, that I would never get to see him alive again. His surgery took 12 hours. When the doctors came out and told me that his surgery was over and done with and that he had came out very good, there was just a sense of relief. I was kind of concerned. I thought, you know, that Adrian was gonna have a hard time adapting to having only one leg. He was worried that, you know, he would never be able to get around, that it was gonna be worse than him having that leg.
Over the past 8 months, Samantha Mina has been losing weight at an extremely dangerous pace. Eating more than 3 bites of food makes her projectile vomit, and no doctor can tell her why. But now, Dr. Ziad Haddad has uncovered a lead during an upper gastrointestinal exam.
The contrast could not really progress past the third portion of her duodenum.
The duodenum is the first section of the small intestine, where most digestion takes place.
After the completion of the upper GI series, in conjunction with her history, the diagnosis was pretty clear. I was confident that the diagnosis was superior mesenteric artery syndrome.
Superior mesenteric artery syndrome is a rare condition involving the digestive system and arteries. In healthy individuals, the duodenum, located at the top of the small intestine, runs between 2 branches of the superior mesenteric artery, or SMA. But in patients like Samantha, the duodenum becomes pinched between the 2 blood vessels, making it impossible to digest food.
In healthy individuals, as the duodenum passes underneath the SMA, the angle is wide enough for the flow of food. As that angle becomes more and more narrow, it starts to compress the duodenum. So think of the angle as an upside-down V or almost like a nutcracker. As the angle becomes more and more acute, it compresses the duodenum more and more.
I definitely couldn't believe it. There's an artery cutting across my small intestines, preventing me from eating. I wanted to shout from the rooftops, like, we found what's wrong with me. I don't have an eating disorder. I'm not anorexic.
However, Dr. Haddad suspects Samantha's small frame probably set the stage for the disorder.
I'm not sure what the tipping point for Samantha was, but that weight loss then exacerbated what was already probably a narrow angle for her SMA. Once that angle narrowed beyond a certain threshold, then the obstruction began, and then her downward spiral began. Your digestive tract is just like any other plumbing. When there's an obstruction, things back up. Vomiting is almost like a protective mechanism to decompress those structures. So she was vomiting, she wasn't getting enough nutrition, and thus she's had weight loss. Had Samantha never been diagnosed and never been treated, she would have continued to lose weight, and that would have been a life-threatening condition.
After I was diagnosed, I was extremely relieved. I was just thrilled, and so was my mom. Everything fell into place. I wanted to know what to do.
The treatment is a surgical procedure where you're basically reconfiguring the bowel, the small intestine, in order to divert the flow around the obstruction, such that food is not going underneath the SMA anymore, it's going around it.
But the surgery is risky. Samantha is so underweight, heart failure is a real possibility.
My worst fear when Samantha was going to surgery is that she is very, very thin, and it might be too much for her to handle. So it was scary to know that she might not come out of it.
And there are other serious complications that Samia and Samantha must face.
The surgeon explained to me that there is a possibility that the superior mesenteric artery would be severed, and that would cause hemorrhaging. This is a major artery that branches right out of the aorta, which stems straight from the heart. So to hear that from just nicking that artery, I would bleed to death was terrifying. I remember just crying, saying, "Is there any other way? Is there anything else that can be done besides surgery?" He said, "I'm sorry, no. If you do not have the surgery, you will die." I decided that despite all the risks involved with a surgery like this, that I would go through with it. My surgery was scheduled for 3:30 p.m. on January 31st, 2008. I just felt like, let's do this. I'm ready to have my life back.
Finally, Samantha is wheeled into surgery.
It was a long wait. I've been through a lot in my life, but that was the worst experience I ever had.
After 8 long hours, the operation is complete.
I remember waking up in the anesthesia recovery room, and I saw the surgeon there, and he said, everything went according to plan, everything is fine. I felt relieved. I was told I had to take at least 1 semester off, but I needed a year to recover from SMA syndrome as a whole. I was put into physical therapy because I had lost a lot of my muscle mass from all the weight loss and the malnutrition.
She still had to be on some liquid diet and then soft diet, and then little by little introducing the solid food. So it was like a mother who is feeding a baby. Every day was an improvement for Samantha, and that was exciting.
I remember standing on the scale at a post-op appointment and seeing that scale read 85, and that was the most beautiful number to my eyes. I was just thrilled, and so was my mom.
As Samantha begins to recover, she can't help but wonder why not one of the many experts she consulted was able to recognize her condition.
SMA syndrome is a rare disease. The diagnosis of SMA syndrome is hard to make on a clinical basis alone because the symptoms associated with it are fairly nonspecific.
Over the last 5 years, Adrian Martinez has suffered from a painful, disfiguring disease that left his leg weighing a shocking 150 pounds. Now, he's undergone an amputation and is faced with the extraordinary challenge of making a new life for himself.
I didn't really know what to think. I didn't know if I was gonna be happy or sad. When I looked down at my leg, I just felt like the whole world was just lifted from my shoulders. I felt lighter, and I felt happy about the choice that I made.
Still, Adrian can't help but wonder why so many other doctors failed to identify the disease.
From his records, they estimated that the leg itself weighed up to 150 pounds. Over the past 30 years in my practice, I've seen only a handful of patients with this severity of KTS, and I've probably seen upwards of 1,200 or 1,500 patients with the syndrome.
Today, Adrian is 17 years old and about to enter his senior year of high school.
This last semester I had straight A's. I hang out with my friends a lot more often than I used to.
Since the amputation, Adrian is more social. He feels more comfortable. It's like whatever problem there was is no longer there, and now it's open to just being Adrian.
For now, he gets around school in a wheelchair and uses crutches at home. But he's looking forward to using a prosthetic leg one day.
I got a prosthetic leg, but the muscle in my stump is not strong enough as it would be if I had more bone. I have to go to therapy to learn how to walk with my prosthetic.
My hopes for Adrian's future is that he gets up on that leg and he's able to walk on it with no problems. He can get into college and, get a good career.
I know that Adrian is going to have a great future. He is such a special kid, such a special soul.
I want to tell Mr. Perez, thank you for helping me out, even though he didn't really know me, and for being there for me as my friend. If it's possible for me to have a better life, today I feel really good.
Here's this kid that went ahead, accepted his condition, made a decision, and now he is moving on with his life.
Today, Samantha feels better than ever. She graduated from college with honors and her future looks bright.
I feel like I do have my life back. I do anything I want to, social events. I have more energy.
Samantha gained 30 pounds since she got sick. She's a blessing. She's a joy. She's happiness.
I would say Samantha is a better person. She was already a great person, but I think her suffering, it's helped her realize what's most important to her in life.
I will soon be starting law school at the University of Virginia. I'm specifically interested in patient advocacy. Sometimes in the healthcare system, you have to be your own advocate. Don't ever let someone brush you aside, say that nothing is wrong and there's nothing we can do about it. There always is something you can do. I am living proof that there is hope for people with my condition.